Hey everybody, welcome to the Big Huntsville Podcast, the show that's all about the people, places, and the stories that make this city an amazing place. I'm your host, Carl Thomas, your favorite realtor, singer-songwriter, and all-around Huntsville cheerleader. Each week, we'll be shining a light on the community heroes who make this city tick, having some fun along the way, and sharing a few real estate tips when you least expect it. So whether you've lived in Huntsville your whole life or you're just thinking about calling Huntsville your new home, you're in the right place. Let's get started. Hey everybody, thank you so much for being back with us here on the Big Huntsville Podcast, where we are searching out people in Huntsville who are doing big things and oftentimes very selfless things. And our guest today is no stranger to the selfless work. Let me talk about her for a second. Her name is Davina Patterson. Davina is a dedicated advocate and community leader with the Disability Network, where she works to empower individuals with disabilities through access to resources, support services, and inclusive opportunities. Based in Huntsville, Alabama, Davina brings a strong commitment to accessibility and equity, helping bridge gaps between local agencies and the people they serve. Her work focuses on promoting independence and quality of life for individuals with diverse needs, and she is recognized for her compassionate approach and deep understanding of the challenges faced by the disability community. How about that? All right. So Davina, thank you so much for being with us today. I appreciate it.
Thank you for having me. I'm so delighted to be here.
Yeah. Hey, your smile, and I know everyone who's listening probably are not watching the video, but your smile is just amazing. It's just like lighting up your side of the screen. So I'm hoping it stays on you the whole time. So tell me a little bit about what you do and how you got into this line of helps.
Yes, so I'm the executive director of Disability Resource Network, and we're a
Okay.
center for independent living. So we provide independent living services to people with disabilities.
Okay.
I got into this work. I've been in healthcare for over 20 years. So I've worked in hospital settings, patient access. I've worked in a VA medical clinic, surgery centers. So I have a vast amount of experience working in healthcare
Yeah.
with a 20-year career. So my previous job, I worked for a nonprofit. I was a manager for a federally qualified community health center. And so I
Wow.
managed 3 locations.
Oh my gosh.
While I was there, it's a primary health care clinic. They provide primary health care, also with pediatric and OBGYN services. But while I was there, worked with a lot of underserved, unserved communities, worked with those that were on Medicaid and some were uninsured. And I developed a passion for working with that community. So my intention was to always work with underserved, unserved communities, bridge the healthcare gap, and close those gaps and make sure we have access to care. So I ended up in independent living, and I've been here since 2020, and it's been a great journey, a great experience, and I love it.
Okay, so when you say independent living, the automatic thought that comes to most of our minds is like elderly care.
Right?
So you're talking about something that's beyond that, though, right? You're talking about
Yes.
anybody, any age that has this disability that needs some helps to be mobile, right?
Oh, yeah. Yes. So
Okay.
we cover all ages throughout the lifespan. We cover all disabilities because we are cross disability. And so we deal with children as well as elderly, everything in between. But you
Wow.
are correct. A lot of people, when they think of independent living, they do think of seniors or older adults.
Yeah, yeah, absolutely. That's the automatic thought. So tell me about there goes my alarm again. All right, I'm so glad. I know to get on this podcast. So tell me about the history, I guess, behind the Centers for Independent Living.
Yes, so Centers for Independent Living, formed from the Rehab Act of 1973, was mandated that there has to be at least one in each state. It was
Okay.
started on the West Coast, University of California at Berkeley, by a college student by the name of Ed Roberts. He's our founder. He's credited as the founder for Centers for Independent Living and Independent Living Movement. Centers for Independent Living were inspired by the disability rights movement and the civil rights movement. So Ed Roberts he had a disability, and him along with some college students on the campus of University of California at Berkeley, they started a community and began a movement where they wanted to have just equal rights and justice for people with disabilities. And so that's how Centers for Independent Living started.
Okay. All right. That's awesome. So, as far as like your pedigree, how you ended up in what you're doing, what led from moving from that last nonprofit to this? How did you land in the middle of this?
How did I land in the middle of this?
Yeah.
It's a simple statement, but it's complex. So I saw an opportunity
Okay.
for a director.
Okay.
I was told that they were starting a new center in North Alabama.
All
At
right.
the time, there wasn't a center in North Alabama. There were currently just 3 existing centers. So the Independent Living Network, which was the State Independent Living Council, and the Centers for Independent Living wanted to expand and create a center in North Alabama.
Sure.
And so there was a search team, a launch team that was responsible for creating and establishing a center for that serves North Alabama.
Okay.
So that's how I got into independent living. I saw an opportunity. I met with the lead of the search team. We talked about the plan and the vision for this center. They selected me as the director, and that's how I ended up here.
Okay, that's awesome.
Yeah.
So I guess I walked through something in life over the last year where my mother had become homebound. And what happened during that time is we spent a lot of money and a lot of time trying to figure out how to make her mobile. So there was a ton of costs involved in that involved buying different apparatuses to try to get her up moving and leading to a wheelchair, leading to a hospital bed, all these different things that were going on. And number one, I was ignorant to any of what she needed. I was having to find my way on my own. I was spending a lot of money. I mention that again because it's very expensive when you get in that situation and you're trying to figure out how to help somebody, because a lot of this health equipment is very expensive. But also it gave me an empathy for people who can't walk, who can't get around, because that life of dependence is hard. It is hard to go from independent to dependent on someone else. So I had wondered, maybe if you had someone in your life or something like that maybe led you into that place, because I have a new empathy I didn't have before. And now I have a more of a maybe a calling to make sure that everyone around me can do what they need to do in life. It's really strange how those kind of things happen. Which, by the way, you said you worked in hospitals, and I imagine like a nursing type position. I have never had anyone who is in healthcare, if I've ever been hospitalized, that has a cheerful disposition like you. I'll
Oh,
always get the other side of the coin.
yeah.
Somebody who like took a smoke break to come and throw me a bedpan or something. So it's so nice to talk to somebody who's spent their pretty much their adult life in healthcare, who's got a cheerful disposition. That's a special thing. Okay, so let's talk about the Disability Resource Network. Can you tell us more about that? Because it's called a network, right? So there are
Right.
other groups working with you, correct? So what is that
So
about?
Disability Resource Network, we're a Center for Independent Living. And that's a 501(c)(3) private nonprofit.
Okay.
We are consumer control, cross disability, non-residential, cross disability organization. We are an independent freestanding Center for Independent Living. So we have partners. We have partnered with partner organization, community organizations to
Okay.
help us to achieve our goals and to also refer our consumers and be a part of the work team. But we provide 5 core services. So the 5 core services we provide are independent living skills training, peer support, we do advocacy, transition services, and we also do information and referrals.
Okay.
Centers for Independent Living were created by people for disabilities, but they're also operated and ran by people with disabilities. So at
Okay.
least 51% of our staff and at least 51% of our board members are people with disabilities.
Wow. Okay. That's amazing. That's awesome.
Yeah.
So tell me, like, if you're in the general public and you're like me and you're ignorant about what's out there, what's available. My first thought was not to find a group like you. My first thought was just to try to handle it all on my own. And I bring up that financial side of that again. That was very hard because every step I would make, it would be more and more expensive. So somebody is going through something. Maybe they have a child that has a disability and is unable to be mobile on their own, things like that. What does the general public do as far as you guys are concerned? Do they come to you and request help, or do they come to the independent living center that you have? What do they do?
So we do receive self-referrals and we receive agency referrals. Our core services are of no cost to the consumer. We receive state and federal funds.
Okay.
A lot of that, what you said, that is an issue. So it's very important for our workplace culture at Disability Resource Network to be very welcoming and
Sure.
very inviting for people with disabilities so that they can feel comfortable to come here and receive services. We want them to feel included. We want them to be a part of our center. We want
Sure.
to listen to their feedback, their input. We want engagement with them. And so this is their Center for Independent Living. We're here to serve them.
Okay. All
So
right.
we do everything that we can to make them feel accommodated and to make them feel welcomed.
Yeah,
So
absolutely. So there's been some movements in the recent years with disability rights, right? Is that correct? So tell me more about those. Okay, so what are the important movements right now in the disability rights world?
So you have the Americans with Disabilities Act. That was a big milestone for disability rights. It was signed in 1990. We just
Okay.
celebrated the 35th anniversary on last month. You have the Capitol Crawl, the 504 sit-ins. You have the Rehab Act of 1973. All of these are important and key movements. And then the independent living movement, the disability rights movement. You have the Architectural Barriers Act, the IDEA Act. There's so many movements and legislations that have impacted disability rights, civil rights, equality, Fair Housing Act. You have the EEOC. There's so much that have affected and impacted people with disabilities. So those are just a couple of our important movements. And I try to make sure that our team is aware of it and they know about it. Because if we're going to be working with people with disabilities, we need to just be conscientious of that.
Yeah, absolutely. And it's so easy to get in your own world and deal with your own problems and not realize that there are people around you who are struggling to even move. I see it. There's a place that I go weekly. I actually go in there today, and I get to work with homeless folks who are trying to get in a better position in life. And probably half of those folks have walkers, canes, walk with a limp, things like that. And these are people who
Right.
have no opportunities in life right now. They're in a place where they're trying to figure out how to improve their life, but they also have a disability they're walking around with. I feel the fact that, I don't know, government, us, people are trying to give those folks more rights when it comes to getting jobs and things like that is a huge help in the world right now. Just because I think if somebody's hiring and they can't make a judgment on somebody based on the fact they walk with a limp, that's a good thing. That's a really good thing. Okay, so the last thing that I have to cover today, and I don't have a clue what it is state of disability with Mariatown. Can you tell me about that?
Yes, the State of Disability with Mariatown. This is our first year doing it. So we're excited about this. We have
Okay.
Mariatown, she's the CEO and president of American Association People with Disabilities, which is a national organization that work with people or support and represent people with disabilities. She'll be coming to Huntsville on August 27th. There'll be an in-person and a virtual meeting.
Okay.
Well, option, I'm sorry. There'll be in-person and virtual options. The in-person meeting will be at Four Point Sheraton at the Huntsville Airport. And then the virtual option will be on the Zoom platform. You do have to register. So
Okay.
registration is required. And you have to let us know which option that you plan on attending. But
Okay.
Maria, she's going to come and give a report. She'll be presenting a report on the update of disability. So she'll be addressing legislative updates. She'll be doing a Q&A. She'll also be talking about employment. She'll be talking about economic and poverty. She'll also be talking about civic engagement and voting, progress and culture change. So much that's impacting and affecting people with disabilities because we're getting a lot of calls and people are concerned about defunding of disability programs.
Yeah,
They're
absolutely.
uh,
There's so much
concerned
changing
about
right
so
now.
much. Yes, it's just a lot. And so she's going to come down and give this national report to our community and give an update on everything. So hopefully we can get some of these questions answered. We do rely on our national partners to keep us updated on legislation so that we can know what's going on and we
But
can help
absolutely.
inform our consumers in our community.
You're here for the ignorant people like me who just
Oh,
don't know what's available. Really, honestly, that is why what you do is more of a calling than a job.
I
Because
agree.
you are helping people to know what options are out there to walk through something that they may not have a clue on how to walk through this thing. And you're making people's lives better. And that's huge.
Sure.
So is this Mariatown, when she comes, is this a ticketed event that people can buy tickets to, or is this a free event? How does that work?
No tickets, no
Oh,
admission fee. This will be free. This
okay.
is valuable information. People need to know about it. We're not
Sure.
charging for this very important,
So how does the general
crucial
public
information.
get involved in this? How do they get to this? Where do they go to find information about what you're doing and this event?
So since we've been doing so much, we've been getting a lot of traction on our social media website.
Okay.
So we have mailing lists to keep everybody updated. Those are some of the platforms that we use to get everybody updated and stay current in what we're doing. But
Okay.
they can reach out to us on our website.
What
They
is the
can,
website?
our website is www.drn256.org.
All
So
right,
that's
slow it
our
down a
website.
little.
I
Slow it down a little bit.
need to slow down. I'm sorry. I'm a fast talker.
Yeah, it's fantastic, and you enunciate well, but I'm just a slow listener.
Are you? Okay. Well,
Website
let
one
me
more
slow it
time.
down.
Okay, one more time on the website.
All right. Website www.drn256
Okay, 256. Okay, DRN 256.
.org.
Okay, all right, good deal. And what about social media? How do they find you on social media to follow what you do?
Social media. We're on Instagram. So we're at DRNAL256.
Okay,
We're on Facebook. We're on TikTok and LinkedIn. And on those platforms, it's just Disability Resource Network.
okay, fantastic. As acting as a 501c3 as a nonprofit, if someone feels called to donate, is that something they can do through the website, and or how would that work?
Yes, they can definitely donate through the website.
Okay, all right.
They can definitely donate through the website. Like you said, we are a 501c3 organization. So we do take donations and they are tax deductible.
Right. And I can only imagine if I was walking through something and you helped me walk through that if I was to go and sit down with a lawyer and put together a will, leaving money to an organization like yours would make a lot of sense. So just keep
That would
that
be
in
great.
mind, folks, that there are places like this who are focusing on helping those of us who are in this situation. And financially, they depend on those of us who are willing to give to help them continue their mission. So just don't forget that. Definitely check out their website, check out their social media, follow them so that you can keep up with what's going on in their world and what's going on with just disability in general, because they're actually working hard to keep information in front of them that gives them the ability to help us more. Definitely follow them on that, and then check out that State of Disability with Mariatown that's coming up. Miss Davina, thank you so much for being with us today and telling us about something that most of us probably don't know about. It's so cool
Yeah.
that there's so many things like this happening, and a lot of it is happening right in the middle of Huntsville, which is awesome. So thank you for what you do to make this place, a better city to live in, a city that is selfless in a lot of ways. There are a lot of people doing selfless things like you guys do. I actually spoke with a really sweet lady with Christmas charities year round,
Oh,
and
yeah.
They do a lot with equipment for people that are disabled and trying to get those to people. So there are so many neat things like that happening behind the scenes that folks like me who are self-focused and on the drive in life may miss. So thank you
And
for
I
what
also
you do.
wanted to say something. We did talk about physical disabilities, but I want to make sure that we bring to the awareness there are people that have invisible disabilities. They have
Sure.
disabilities that are hidden that you can't see.
Right.
So we work with people with all disabilities. We do understand and we know that we have people out there that have invisible disabilities. They're battling, internalizing things that
Sure.
nobody understands. They're in pain and they need help as well. They need
Wow. Yeah.
healing as well.
Wow, that's incredible. Huntsville is a city on a military base,
Sure,
and there's a lot of PTSD. There's a lot of mental issues. We've talked to folks on this show about that. So there are a lot of things happening around us that we don't see. And that's really great that you guys are offering a hand. When you think of anything disability related, you think about physical disability. So thank you
sure.
for bringing that up. That makes a lot of sense. Okay,
No problem.
so definitely go check out the website, go to their social media and follow them. And remember the name Davina Patterson because she's out here living a life of mission to help our city. Okay, Davina, thank you for being with us. And thank you all for tuning in to the Big Huntsville Podcast, where we look for people like Davina. And we will continue to find those people and share them with you. Y'all have a great day. Thanks for tuning in to the Big Huntsville Podcast. If you've enjoyed the stories, the laughs, and maybe learned a little something new about our amazing city, remember, Huntsville isn't just a place, it's a community. And we've got some of the best folks around. So if you like today's episode, please don't forget to subscribe and share it with a friend. And if you got a local hero or story you think we should highlight, hit me up. I'd love to hear about it. Until next time, I'm Carl Thomas. Keeping it fun, keeping it real, and always keeping it big here in Huntsville. Catch you later.